Community Analysis of Ruskin by Kristen Borelli and Kate Laddie.
Ruskin, Florida is named after an English writer and critic who advocated for social changes and the importance of higher education, John Ruskin. Dr. George McAnally Miller had a vision that all people should have the chance to accomplish higher education. In 1910, Dr. Miller began Ruskin College on the Ruskin Inlet. Despite the college burning down and Dr. Miller passing away in 1918, his educational ideal remained in Ruskin. In a way to attract tourism to the area, Ruskin hosted the annual Springtime Ruskin Tomato Festival starting in 1935, and it is still celebrated to this day. A man named Paul Dickman is responsible for the agricultural success of Ruskin. Although agriculture has remained important to Ruskin throughout history, its crop yields would change over time. Today, flower farms, phosphate, real estate, and tropical fish farms began to prosper. While driving through Ruskin, a variety of housing characteristics were noted. There were many new subdivisions being built that were advertised to cost between $100,000 and $250,000. On the south side of Ruskin, there are many mobile home parks. The area south of 19th Street is where low-income housing was observed. There is a large migrant population in this area because it is close to the farms where they are employed. The west side of Ruskin has older brand new houses located on the water. These homes are more expensive because of their location on Little Manatee River. Ruskin has numerous fast food restaurants, a Publix, and fruit stands available for the community's nutritional needs. Ruskin meets the needs of the community structurally with the selection of options for housing in a variety of price ranges. Because the population of Ruskin is continually growing, roads need to be expanded to accommodate for traffic. In 2014, Sandra Merman was elected to serve as chairman on the board of county commissioners. She is a representative of the Republican Party. Merman is very involved in her community. There are 7 members on the Board of County Commissioners for Hillsborough County. 4 are elected from single-member districts, and 3 are elected county-wide. The board discusses and takes action upon the county's operating and capital budgets. It may get involved on any program for the enhancement of the county and the prosperity of its residents. Under a charter ordinance that went into effect in May 1985, county commissioners are appointed to perform legislative duties of government by creating policy for the organization of Hillsborough County. The county administrator, a professional selected by the board, and the administrative staff are accountable for the execution of these policies.
Per the 2010 census, the population of Ruskin is 17,218. The percentage of population has expanded by 106.8% from 2000 to 2010. The predominant races in Ruskin, Florida are whites, 44.2%, and Hispanics, 40.5%. The large population of Hispanics in Ruskin is due to the agriculture industry and the need for farming jobs. Most of the farming jobs in Ruskin are occupied by migrant workers. 150,000 to 200,000 migrant and seasonal farm workers and their families travel to Florida each year for work.
A major concern in farming communities like Ruskin is the environmental and socioeconomic health inequalities migrant workers endure. Many migrant workers came to the United States to get away from devastating poverty and to give their children better opportunities. At least 6 out of 10 American farm workers are undocumented immigrants. On farms across America, migrant workers produce billions of dollars worth of produce yet still live in poverty, endure humiliation and exploitation in the workplace, and live in constant fear that their families will be ripped apart if they are discovered as being undocumented immigrants. According to a recent study, if the U.S. deported all immigrants, it would leave a gaping $2.6 trillion hole in America's economy over the next decade. Primary care is shown to increase regular access to care, enhance patient outcomes, and reduce health disparities. Unfortunately, migrant farm workers are a vulnerable population in the United States, with limited access to health care. Migrant farm workers rarely have health insurance, especially those who are undocumented, since they are not able to obtain health insurance through the Affordable Care Act. These challenges result in the individuals foregoing necessary health care, which leads to poor health outcomes over the short and long term. Migrant farm workers are at a disadvantage by social detriments of health that limit resources and opportunities for health promoting behaviors and improving their conditions of daily life, such as living and working circumstances and access to health services. The Bureau of Primary Health Care (BPHC) mission is to provide quality primary care to those in need regardless of racial or ethnic origin, insurance status, or socio-demographic characteristics. The Migrant Health Center (MHC) program delivers support to health centers in order to provide the highest quality of care to migrant farm workers and their families. Florida Farm Workers Service Programs offers healthcare services through the Florida Association of Community Health Centers, FACHC. Suncoast Community Health Center is a not for profit organization. No patient is turned away because of their inability to pay. They accept cash, money orders, and credit debit cards as payment in addition to the patient's insurance. Services include adult internal medicine, family medicine, pediatrics, women's health, obstetrics, dental, behavioral health, pharmacy, optometry, and family planning. The Bethel Farm Worker Ministry is a non for profit corporation. The ministry offers healthcare assistance, such as funds to assist women with pre and postnatal care, semi annual health screenings through the Florida College of Nursing program, on site mobile health clinic through Suncoast Community Health Center, on site visiting nurses from La Esperanza Clinic, and mammogram screenings through Moffitt Cancer Center. Health Community Objections for Ruskin, Healthy People 2020. Number 1, access to health services. The timely use of personal health services to achieve the best health outcomes. The community of Ruskin needs more of its population to be insured, additional community health centers that are geographically available, and more culturally competent health care providers that can communicate. Rationale. Access to all-inclusive and quality health care is essential to promote and preserve health, prevent and manage disease, diminish unnecessary disability and death, while accommodating health equality for all citizens. Number 2, reduce coronary heart disease deaths. Controllable risk factors for heart disease and stroke include high blood pressure, high cholesterol, cigarette smoking, diabetes, unhealthy diet, lack of physical activity, and obesity. Ruskin requires interventions with the participation of community health workers to minimize the prevalence of cardiovascular disease. Rationale. Ruskin is a community within Hillsborough County, and the county's second leading cause of death is heart disease at 34.43%. Controlling these risk factors remain a barrier to many communities like Ruskin. It is crucial to adopt healthier lifestyles and address these modifiable risk factors early on to prevent heart attack, heart failure, strokes, and other complications of chronic cardiovascular disease. Number 3, reduce social detriments of health. The health of a community is determined partially by its member being able to access social and economic opportunities, accessible resources in the home, safe workplaces, quality schools, the environment such as water, food, and air, and the type of social interactions and relationships. Ruskin must improve upon diminishing the health disparities among its community members that have to attend social, economic, or environmental disadvantages. Rationale. More social policies need to be created to minimize environmental injustice, which is directly correlated with influences that link poverty with poor health, including inadequate access to medical or preventative care, lack of availability of healthy foods, absence of safe places for children to play, shortage of good jobs, crime, and violence. The environment of Ruskin is adequate with proper water supply and quality, sewage disposal, and quality air. Ruskin's environment includes a wide variety of parks and an all-purpose recreation center. A community member with students interviewed expressed her concerns that the bars in Ruskin offer smoking inside their establishments. Another community interviewee voiced their concern about the suburban housing developments depleting the community's farmlands, parks, and natural resources. Currently, Ruskin plans to keep commercial developments geared toward the downtown area and continue to make Ruskin a destination for ecotourism. Prioritize community needs. There is a lack of primary care physicians in Ruskin. During the windshield survey, it was noted that there were 2 primary care offices in the area. That is not enough to serve the moderately sized community. No mental health counselors were noted in the area during the windshield survey as well. Mental health is very important when treating the person holistically. During the windshield survey, many fast food chain restaurants were observed. There were some fruit stands on the sides of the roads as well. Otherwise, there were not many healthy options available for the community, such as a Whole's Food Market or a fresh market. Ruskin's population is on the steady incline. Rush hour traffic can be a problem in the community. Ruskin needs to expand the small 2-lane roads to accommodate the overflow of new families that have moved to the area. Another need for the community is more traffic lights on the busier roads. Ruskin has several main roads that are used to navigate around town. The city has not updated traffic lights for the areas of high congestion. A final community need recognized by the windshield survey is more streetlights. While driving around the community after dark, it was noted how dark the streets were, and this can be a safety issue and a problem for visibility while driving.
Thank you for listening about our presentation on Ruskin. Here are the references. You all have a nice day.